Hi, it's Dr. Jerome Fryer of Dynamic Chiropractic Clinic. Today I am going to talk about the foot and how it relates to the knee. So people often ask me, how's my foot? Is my foot functioning appropriately? And I often ask, well, do you have any symptoms? That's kind of where I start, because everybody's feet are a little bit unique, and don't make fun of somebody else's feet. First rule. But the second thing is, you want to pay attention if there are symptoms not necessarily associated with the foot, but of your knee. If you have medial knee pain or pain on the inside when you walk, or you walk for an extended period of time, and then you have this sort of low-grade kind of medial knee pain, one of the things that you can look at, or I look at, is the degree of pronation. So the pronation is when the foot strikes, okay? There are these arches, okay? There are actually three arches. One is on the medial side here, longitudinal medial arch, okay? Long, medial, big arch, kind of like the arch of a bridge, right? Right? So it's kind of the big one. And then there's another one on the other side, the lateral, and there's also transverse metatarsal arches across here. But the big one that I pay attention to is medial arch. And some people have excessive bowing or pronation of the medial arch. So as the foot strikes, what happens is everybody's a little bit different, but some people, the foot flexes down too far, and that creates this torsion. As the foot comes down, this actually internally rotates. So this knee kind of, this tibia here rotates inwards. And what that can do to the knee is here's the knee that I've created, a model knee joint. Okay, what that does is now this bone, okay, which way was I going here? That's it. So this bone will actually internally rotate. You can see that. This one kind of goes boom. Every time you step, boom. And this guy's got to follow. This one has to follow. So this goes. So there's too much rotation occurring. That puts added stress on the medial side of the joint where the meniscus is. And that can have an impact on the subchondral bone or the meniscus or even the ligament in here. So one of the things that I do is called a navicular drop test. So a navicular drop test is to see how much this bone, navicular comes from the word navy, shaped like a boat. There's a bone shaped like a boat right here, this one here. As I mark it when somebody is non-weight bearing, all right, the height of it, I mark it off the floor, and then when somebody puts the load on it, then I see how much it drops. And some people's naviculars drop too much in relationship to their knee. So one of the things that I do is I work to help kind of control this, and I also do orthotics to help control that if we can't do it naturally through muscle strengthening. So anyways, there's a foot. And hopefully you learned a little bit with regards to a flattened arch as it relates to hyperpronation, and the rotation can occur up into the knee. So I hope that was helpful.